those who knew him, Dr. Frank was more than a colleague. He was a visionary dedicated to advancing musculoskeletal health. I am Judy Crawford, and for 27 years, I was Dr. Cy Frank's executive assistant. Dr. Frank's career was marked by numerous accolades, including his role as the inaugural scientific director of the Institute of Musculoskeletal Health and Arthritis. He was also named as an officer of the Order of Canada in recognition of his unparalleled contributions to medical research and healthcare in Canada. His influence can be felt in all corners of the healthcare sector, from cutting-edge labs to clinical settings where lives are transformed. The McCaig Institute for Bone and Joint Health, along with the Cummings School of Medicine, proudly supports the Cy Frank Legacy Lectureship, which ensures his vision continues to thrive.
Dr. Frank was obviously a passionate orthopedic surgeon and a passionate advocate for quality healthcare. And he really initiated quality improvement initiatives around joint replacement surgery and access to orthopedic surgery overall. He established the Western Canada Wait Time Alliance and a series of projects that really for the first time looked at how we could bring people through a centralized triage program for joint replacement surgery, which is so important for people living with arthritis. I think overall, he was fundamental to a series of collaborations that really advanced arthritis care and research in Canada.
I first met Cy when he put me back together after a sports injury in 1984, and our collaboration lasted over 30 years. So that was a tremendous impact. Cy has contributed to improving patient outcomes and clinical practice in several ways. One of them would be the integration of research into clinical practice and convincing researchers that we should be thinking in terms of bedside to bench and back again, as opposed to bench to bedside. We need to be aware of what the problems are that both clinicians face and what patients face when we're thinking of how to do the most appropriate research.
From the non-invasive diagnostics perspective, the innovations were really important for learning about how we do our pathways. There was a lot of work on how we measure success, and we were looking at using databases that helped us understand how people did with patient-reported outcome measures after their hip and knee replacements, but also whether they came back early or later with complications for that. So that would be the area where I'd say from the non-invasive aspect that he worked on his technologies. Cy was very involved with trainees at various levels and actually colleagues and junior faculty. And Cy's approach was to be one of inquiring, one of challenging us about what we think or what we might hold, to always have open minds. And Cy was always in an inquisitive, curious nature. This is a picture, this is actually Cy's birthday. He would come over to our house quite a bit, and this is my wife, Kathy, and my two children, our two children, Kurt and Karis. And so we're celebrating here and having a great time. It's very interesting that both our kids now working here in McCaig, they are PhD students. They work in sarcoma research with one of our orthopedic surgeons in sarcoma, Mike Monument. And Mike was also a graduate student in my lab in some of my research. So I would say I look after Mike, but now Mike's looking after my kids. So I'm grateful for the opportunity, and it's just a handing down of the legacy from Cy ultimately.
Dr. Cy Frank's life and work serve as a powerful reminder that through collaboration, impact, and innovation, we can create lasting change. As we celebrate his enduring legacy, we look to the future. Dr. Frank's work is not just a memory, it is a call to action. Join us as we continue his mission to advance musculoskeletal health and inspire new beginnings.